Thank you for joining us. My name is Christy Matheson and I'll be your moderator for today's briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy, and good afternoon, everyone. Today we're reporting one new case of COVID-19. The new case is in the eastern zone and related to travel outside of Atlantic Canada. We now have 9 active cases in our province, and thank you to everyone for your hard work in helping us slow down the spread of this virus. Our numbers continue to be low, but as I've said many times, we can't become complacent. We all know too well how quickly this virus can move and take hold. Think back to the first wave and the tragic situation at Northwood, when the virus got into our long-term care facility and caused so much pain. We don't want that to happen again, so we need to continue to follow the protocols, but we also have to learn from what happened there. We did a number of reviews, including one around infection prevention and control, which made a clear recommendation around single rooms with single washrooms. With that in mind, and the ongoing review of our long-term care facilities underway, we are happy today to announce a major investment to increase the number of long-term care beds in Central Zone and improve our infrastructure across the province. We will be adding 236 new nursing home beds in Central Zone. 44 of those will go to Northwood and Halifax. The remaining 192 will be in facilities determined throughout a tendering process. Also, as part of our ongoing review, 7 facilities have been identified for immediate work based on their overall condition and the need to meet best practices. The following 7, Northwood and Halifax, the Birches in Musquodoboit Harbour, Shoreham Village in Chester, Mountley Lodge in Bridgetown, Grandview Manor in Berwick, R.C. McGilvery Guest Home in Sydney, and Foyer Pierre Fissette in Cheticamp. Sorry to my Acadian friends in Cheticamp, I did my best. We will either replace or they will either be replaced or undergo major renovations. Building new facilities and adding new beds may seem like a simple process, but it takes a team of people and a lot of study and research to get it right. And I want to thank those involved. And I want to remind everyone, this is the first phase of a multi-year overhaul of our long-term care facilities. Our loved ones in long-term care deserve high-quality care in safe and comfortable environments, and it is my hope that these changes will better serve the residents, their families, and staff. Dr. Strang.
Thank you, Premier. That's really wonderful news. Another day with only 1 case reported and 9 active cases right now. This, too, is great news. It's a true testament to the efforts of all Nova Scotians adhering to the public health measures. However, COVID is still very much around us in Atlantic Canada and across the country, and we continue to test for variant strains here in Nova Scotia. This is why we must stay the course and continue our cautious, deliberate approach. I know that we're asking a lot, but it is working. In terms of the vaccine update, we will continue to provide a more detailed information on Tuesday briefings, and there will be a technical briefing as well next Tuesday. As of today, however, I can share that to date we have administered 14,589 doses, almost 3,000 of those were second doses. Any remaining vaccine is scheduled to be used today and next week. By the time we get more vaccine towards the end of next week, our current supply will be used up. And as we get vaccine, it will continue to go into arms or be set aside for people's second dose. Starting today, we will be updating the restrictions announced last week for organized sports and the arts and culture sector. We are increasing the number of people able to gather in groups from 50 up to 60 people without social distancing for sports practices, games, and competitions, and for arts and culture rehearsals and performances. And as a reminder, for sports competitions, this is only for teams or individuals who regularly compete against each other. This increase of 10 people meets the operational and safety needs for some sports and does not substantively change the risk of exposure to COVID-19. I know many in the arts and culture sector are worried about the impacts of our current restrictions because they rely on audiences. We continue to have discussions about potential solutions that are in line with our COVID safety and our current epidemiology. But in the meantime, there are virtual ways to share performances or games. So if you would like to engage a business to record, live stream, or broadcast a performance or game, that production team, that in a contractual arrangement with the business, that production team is limited to 10 people maximum. And they must maintain physical distance from anybody else in the facility. If there is you feel you have a need for more people in the production team, you can submit a proposal to the Safety Division at the Department of Labor and Advanced Education. If you don't want to engage a business to do this, then anybody you do have involved in the production team would have to be included in the group of up to 60 that are allowed for the arts and culture event. And of course, you would have to follow any rules, any other COVID safety rules that are in place. I want to note that the facility, or in the number of 60, does not include facility or venue staff who are required to operate that facility safely. And this would be people like the Zamboni driver, maintenance staff, and security staff. But of course, all COVID protocols around distancing and masking, etc., apply for these individuals. Yesterday, I'm proud to say that my team of medical officers of health, the public health physician team, released an op-ed about how stigma could cause COVID-19 infections to rise. Their key message is Nova Scotians need to support one another, not judge and stigmatize. The public health physician team leads the investigation and supports every single occurrence of COVID-19 infection in our province. They are in the front lines along with their other public health colleagues and see firsthand the damage that stigmatizing people and communities with COVID-19 can do. So I want to echo their message that individually and collectively we need to avoid blaming and shaming and instead focus on our common humanity during this difficult time. Stigmatizing can impact people more than you may realize, and it can have specific impacts on mental health. And with Bell's Let's Talk Day yesterday, I think that raising the topic of mental health is very timely. The Let's Talk process is focused on building awareness, acceptance, and action on mental health, taking the conversation around mental health mainstream. We are living in difficult and extraordinary times, and with this pandemic, mental health has been at the forefront more than ever. We have been required in countless ways to find healthy ways to decrease stress and deal with our difficult emotions while remaining physically distanced from each other. This is no small feat. There are a number of resources available to Nova Scotians to support mental health. Due to COVID-19, our mental health and addictions program has accelerated the launch of several confidential mental health and addiction tools that are free of charge, and you can find them online at mhahelpns.ca. These tools have been vetted through a rigorous process to fill gaps and address needs. And there are a host of other services available on the Government of Nova Scotia website as well. Just because we need to be physically distanced doesn't mean that we need to be socially distanced. Actually, we have an increased need for social connections to support our mental health, and that's critically important as we continue to work through this pandemic. Earlier this month, Engage Nova Scotia, which is a small nonprofit whose focus is a more vibrant, inclusive and resilient Nova Scotia, began a note-writing initiative called From Me to You. This province-wide initiative invites people to send a note of appreciation to someone in their community, someone they know well or a member of the community they haven't even met yet. None of us know what other people are dealing with at any given time, and we also don't know what kind of a positive impact a small and thoughtful gesture can have on someone on any given day. What we do know, however, is that a message like this can bring someone a sense of support for their well-being, and this can be invaluable. So any person, organization, business, or community can request note cards from Engage Nova Scotia. Or you can download the note cards from their website or use other materials they have available. So I would encourage people to visit engagenovascotia.ca to learn more. And it wouldn't be a COVID press conference if I didn't remind you about the importance of taking all the necessary precautions to protect ourselves and our loved ones from COVID-19. So keep washing your hands, maintaining a safe physical distance, wearing your mask, staying home if you're unwell, keeping your social circles small, introducing COVID testing as a regular part of your routine. And today I'm going to add to that list one more thing. That taking care of one another, doing that safely, should be part of our ongoing COVID protocols. We have been doing that well in Nova Scotia. We've been recognized for that, but we need to continue this caring, compassionate approach to each other as we work our way through COVID. So thank you, and I wish everybody a great and a safe weekend. Premier.
That's great, Dr. Strang. It's a great message to continue to check in with individuals. That writing letter campaign is great, and I want to give a shout out to my young nephew Landon, who started doing postcards at the very beginning of the first wave of COVID to keep his handwriting up. So Landon, you were a trendsetter. You started this idea of making sure we write to fellow Nova Scotians. So look forward to getting my next postcard.
I've gotten a couple too.
Yeah.
This is a first, but we're going to take a quick 2-minute pause. We're having some sound quality issues, and we're going to try to get them fixed up before we start taking questions. So we're going to pause for 2 moments, and we'll come back.
Check 1, 2.
Check 1, 2. Check 1, 2.
Still doing it? Yeah, still doing it.
We're going to continue on with the press conference. Some of the audio feeds still aren't perfect. We will be uploading a clear feed this afternoon for those folks who are listening on platforms that aren't clear. For those that have the ability, we encourage you to follow along reading the closed captioning where the audio is not clear. We'll do one question and one follow-up in the amount of time that we have for today. First question will go to Canadian Press, Keith Doucette.
Good afternoon, Premier. I'm wondering on the funding announcement for the beds. I don't appear to see a number there. Is there a ballpark figure for what this might cost?
Well, we're adding a little over $10 million to the annual capital budget of long-term care facilities.
Go ahead with your follow-up, Keith.
Okay, and this one's for Dr. Strang. It's for a national colleague on doses of vaccine. Has the province given any thought about how to decide who gets what vaccine once multiple vaccines are available and the characteristics are approved?
So we're certainly looking for how those vaccines are licensed. We know that the vaccines we have now aren't licensed for children. There may be other restrictions on some of the other vaccines, so we'd have to wait to get that detail. Exactly what are the whether it's age groups or other kind of considerations under which each vaccine is licensed.
Next question will go to Carolyn Ray with CBC.
Hi there. My questions are for the Premier. Premier, none of the issues around the shared rooms and shared bathrooms in long-term care are new. The long-term care sector has been raising this for many years, so why did we not act earlier to begin this process?
We have continued to add nursing home beds across the province. As you know, I've announced a number of them in Cape Breton Island. I think we added a couple of hundred beds to facilities as we began to replace them from one end of Nova Scotia to the other. As we just went through review at Northwood where the recommendations came out, and we're now advancing these projects, and there will be other a multi-year phase of additional long-term care facilities that will be added to the list.
Go ahead with your follow-up, Carolyn.
And Premier, this is coming just a few days before the end of your tenure as Premier. Have you discussed these commitments with the people who might succeed you?
I am still the Premier. I will be the Premier here until, and I'll continue to govern. We as a team, as Treasury Board and as a Cabinet, move through these facilities. And obviously the remaining facilities on the list will be determined by a new Cabinet. We will have done a lot of work around making sure they've gone out, done full assessments around infection control, around what the physical infrastructure is like, and then that list will have recommendations on whether or not we replace those facilities or whether we do major renovations.
Next question will go to Alicia Draus with Global.
Thank you. Premier, can you give an update on the empty beds and the waitlist numbers? I know in the fall the province had withheld funding from 24 long-term care homes that didn't fill vacant beds that they were required to, and there were more than 360 people awaiting placement. So what are the latest numbers?
So I don't know those. I do know, I think you may have asked the Minister this question, or someone asked the Minister this question last week. Those beds that we were withholding funding for have been filled. We were making sure that somebody was going to be placed in that bed, and it's my understanding that those beds and those operators are now receiving patients.
Go ahead with your follow-up, Alicia.
And staffing was one of the big concerns during the first wave of the COVID-19 pandemic. So with this announcement for, hundreds of new beds, is there also going to be additional funding for more staff?
Well, there has been ongoing investments in training to make sure that we have the staff required to fulfill these commitments, and that will be ongoing. That will be, as you can appreciate, will take multi-years of continue that training.
Next question will go to Natasha Pace with CTV.
Thank you. Dr. Strang, I just wanted to ask you, first of all, about the variant. Can you give us an update on how many samples you're still waiting for from the national lab to come back?
We haven't heard anything more back from the National Lab. I checked in with the lab today. I'm waiting to hear back from them. We're working to get a weekly update from the National Lab. It just hasn't, appreciating how busy they are as the one reference lab in the country that can do this sequencing. But we are working with them to get regular updates.
Go ahead with your follow-up, Natasha.
Okay, and Premier, I'm just wondering, just on the beds, I know you said this was kind of the first phase of a multi-phase plan, but does 230 new beds, does that go far enough?
Well, as you know, as part of the first wave, we removed 100 beds from Northwood to reduce the number they had. What the announcement is today, that those 100 beds plus an additional 44 will be built on a new campus, and then the other 192 will go out for private sector to tender on, and we'll continue to make those assessments. As you may remember, when we've announced new facilities, like in Mahone Bay, for example, I think we added additional 35 beds there. So we added another 10, I believe, in Clare. There was, I forget the exact number, we had in Cape Breton, 48 in Eskasoni. We're building new. There's 38 in North Sydney, 36 in New Waterford. So we continue to look at where the need is across the province by continuing to follow the demographics, and we'll continue to do so. But obviously, the capital region is where we would be adding those additional new beds at this moment in time.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. For Dr. Strang, a logistical question about vaccine supply and waste. It's my understanding that there must be a system set up to quickly get somebody else who is eligible for a vaccine in for a dose if there's a last-minute cancellation. I'm wondering if you can talk about this process and how the province is ensuring all doses are used.
So in all of our clinics, we rely on, as we're still focused on in our hospital-based clinics, it's mostly hospital-based healthcare workers. We work very closely with Nova Scotia Health Authority Occupational Health and Safety Program. So if there's somebody who can't, for whatever reason, attend the clinic that they're scheduled for, they'll very quickly get somebody else to fill that spot. As much as possible, we want to take somebody who's in the existing priority groups. But if we don't, we'll go next down the line in terms of priority, and we will make sure that the vaccine goes into somebody's arms rather than be sitting unused.
Go ahead with your follow-up, Lindsay.
Thank you for that. I have a question for the Premier. When Minister Casey announced she would be stepping back from politics, she clarified she'll carry out her term as MLA for Colchester North until an election is called. I'm wondering if you plan out to carry out your term as MLA for Annapolis after you step back from your role as Premier.
I will continue to represent the people of Annapolis until the day that I decide I'm no longer going to do that, and they will be the first people that I notify.
Next question will go to Nabal Snan with the Herald.
Good afternoon. So, Dr. Strang, we've heard from some people that they're upset that groups such as Scouts have a maximum of 10 people per patrol, both indoors and outdoors, while others, like team sports, have a maximum of now 60. Can you shed some light on why regulations for these two groups are different?
So it's simply a matter of we shut down all gatherings over Christmas, other than for faith gatherings and weddings and funeral ceremonies. And now we're slowly, carefully opening up the types of gatherings. We started knowing the importance of both for physical and mental health. And so we opened up opportunities for all ages for sports and for arts and culture events. We continue to look at how we may need to go where we can go next. Fully appreciate, I've had a lot of correspondence in the last couple of days from Cubs and Scouts. Fully recognize the importance of those type of organizations, and we're looking at where we might be able to go next. Open up other types of meetings or ways that people get together for a range of purposes. But our approach to this is always slow and carefully. And yes, it may mean that some people aren't able to do things at the same time others are. But it's a slow, careful careful approach that we have to open one area up, see what the impact of that is. The reason we went first with sports and arts and culture was a recognition of the importance of those. By no means diminishes the importance of other activities, but again, it's a step by step, and I would ask for the patience of individuals, families, and organizations while we work our way through this.
Go ahead with your follow-up, Naval.
Oh, sorry about that. Dr. Strang, from my understanding, different countries have different ways of determining that a COVID case is resolved. Some require a negative test result. Others say a case is resolved when a person is done with quarantine. Can you give us more details about how Nova Scotia Public Health determines if a case is considered resolved?
So we have a consistent approach that's been agreed on by all provinces and territories. At the very beginning, we were looking for a negative, people to test negative, but we realized very quickly on that people could have their infection resolved and no longer be able to spread the virus to anybody else, but the virus could persist in their nose and throat, and you can test positive for weeks after. So having a test doesn't work. So the standard definition we've come up with and has been working with the clinical experts is that people a minimum of 10 days after the start of their symptoms, or if they haven't had any symptoms, a minimum of 10 days from the date that they were tested. If all their acute symptoms, fever, headache, etc., are resolved, then they can be considered to have their infection resolved, and they're no longer able to spread that virus to anybody else.
Next question will go to Elizabeth Patterson with the Cape Breton Post.
My question is to the Premier. The 7 homes that were chosen for immediate work, is there any idea yet which ones will actually be replaced, or has that been decided yet?
Some of them have been deemed that they will be already announced they'll be replaced, and that would have been communicated to those homes. There's some others that will look at whether or not the large renovation or extension would suffice, or whether or not it will cost almost as much as replacing the building. But that work is ongoing. Would have been communicated to the homes. I don't actually have that in front of me.
Go ahead with your follow-up, Elizabeth.
No follow-up.
Next question will go to Tim Biscay with the Halifax Examiner.
Good afternoon. Premier, last November, the federal government announced the COVID resilience stream, which was $82.8 million for Nova Scotia, and that money could have been used for long-term care beds. Was it, or is there federal funding going into the announcement that was made today?
No.
Go ahead with your follow-up, Tim.
Yeah, all beds are welcome, but last I heard there was 1,500 and some long waiting list. Nova Scotia population is getting older. The PCs in opposition say they want 2,000 more beds. With this announcement, are we treading water? Are we getting? Is there improvement? Is it not enough? What are your thoughts on that?
No, as I said, this would be the first phase. There's an entire review of our long-term care facilities and putting through the lens of infection prevention controls within those facilities. They will require, in some cases, either complete replacements or major renovations to meet the current standard today. And these are 7 that we announced, plus these additional 230 long-term care beds that are new. And then, as I said, there's another group of facilities that will be coming in to the cabinet with recommendations on the next step, and part of that, I'm sure, will be adding long-term care beds, new beds as well. But that'll be something that, as the data around these individual facilities gets disseminated and gets sent into the cabinet, then the cabinet will make a decision on what next group of facilities go, and quite frankly, where they're required.
Next question will go to the Coast's Victoria Walton.
Thanks. So you talked a little bit, Dr. Strang, about mental health today, and we've seen some other places shorten quarantine time down from 14 days based on some recent understanding of the virus. So how are you balancing that new research with some of the negative effects that people have from being stuck inside for 14 days, especially during winter, and their mental health?
So it's recognizing the challenges. However, I'm not aware of any good data which would say that you can safely decrease the quarantine period. If you're less than 14 days, you are increasing the risk that somebody even late in that 14-day period could become infectious. We've had a couple of recent cases like that right here in Nova Scotia, that people very late in their 14 days and even became infectious. And then they were beyond the 14 days, they were able to then be transmitting the virus. There are other jurisdictions that are actually increasing their quarantine period to 3 weeks because of concerns around the variant. So understanding the challenges around the quarantine, but also we need to understand the value the fact that we have required most people to quarantine when they come into Nova Scotia from very early on in the pandemic has been a cornerstone of the success of our ability to control COVID. So we would not move away from that unless we had very solid evidence that it was safe to do so.
Go ahead with your follow-up, Victoria.
Thanks. And I just want to continue, I think, on mental health. I'm just wondering, the things we highlighted today, like Bell Let's Talk, which has itself largely been criticized as a corporate campaign in recent years. And I know you also mentioned a letter-writing campaign that kind of puts the onus on individuals helping each other. Has the province put any funding towards more mental health resources and expanding things like therapy coverage that aren't typically covered under provincial health care?
And I'm not involved directly in the mental health piece. I mean, there's certainly lots of ongoing discussion about how we continue to focus more attention on mental health. I think a key piece is rapidly working to make these email health tools available. They don't solve everything, but they certainly are an important part of increasing access to mental health supports. We did it. I've been involved in discussions in the last couple of years with this in universities, and now expanding this for the general population. But we certainly need to continue to focus on mental health as we move forward.
In every budget that we've introduced, we continue to add to the mental health budget as well. We announced early on in COVID additional funding to deal with the issues of mental health. But I don't want, by your question, anyone to dismiss the impact that we can all have by reaching out to someone else. I think that's critical. I think I'm asking Nova Scotians to continue to do what we have always done, which is look out for one another and support them. We all know this has been a challenging 10, 11 months, and a phone call makes a big difference. We can all do our part. I'm hoping this weekend after this outing and Dr. Strang's message around mental health, that all of us will take an opportunity this weekend to reach out to at least one person outside of our immediate family, just to check in to see how they're doing. And yes, we as a government will continue to invest in the mental health, and as we're putting together a budget for the new cabinet and new premier, it will be a focus.
Next question will go to Shayna Luck with CBC.
Good afternoon. In the release, it does say there will be a review of the facilities, but some of those homes, like Grandview Manor or Northwood, they did do some work already, developing some plans of their own for renovations. So I'm wondering, why is further review necessary, and how long will that take?
Some of them have already have gone through that process, but we would go through reviewing those facilities. But as you know, the report that we did around Northwood had other recommendations, so we reassess those facilities. And as I said to one of the earlier questions, some of them we know now will be replaced. I just don't have that list in front of me. Others will be major renovations that we know we can do with inside the footprint or add to the current footprint and then renovate the existing home to meet the new standard of today. But for these 7, much of that work is ongoing. What will be going out now will be looking at design work.
Go ahead with your follow-up, Sheena.
You mentioned, the infection prevention and control report, the Northwood report. Why not announce these changes at that time? We knew a lot of information about that infection prevention control earlier. Why not announce this at that time when you received that report?
Well, as you know, this is across the province. We're looking across the system holistically. We assessing, and the department of people in there would be identifying where do we need new beds. Where are the facilities that we require us to replace, and as we replace them, we look at can we expand that footprint. As I said earlier, I think we added 35 new beds on the South Shore in Mahone Bay. We added 10 in Clare when we looked at the replacement of those facilities, and then we looked around the people on the wait list. What does that look like? How do we add? And so it's not as simple as just deciding today you're going to build X number of beds. You have to make sure that where you're putting those beds in the right place for the right kind of care. At the same time, you're investing in home care, where the vast majority of Nova Scotians continue to tell us where they want to be. So you have to holistically look at our system when it comes to delivering care. And that's what we did. And we received that report, made the assessment, looked over how far we were in some of our facilities. This group was further along, but we will be leaving, I will be leaving to the new cabinet a list of other facilities that have already started to go through this process, and with recommendations on what the new government can do.
Next question will go to Sarah Moore with The Signal.
Thank you. Dr. Strang, there's news today that Moderna is behind on its vaccine shipments and is cutting back on deliveries to Canada in February. What does this mean for Nova Scotia?
So I'm not aware of that. If it's breaking news, we'll have to, get the details on that through the federal government, the National Operating Center, and we'll accommodate to whatever adjustment we may have to make.
Go ahead with your follow-up, Sarah.
Thanks. And also for Dr. Strang, with the more contagious variants of the virus in Canada, some experts are recommending that people wear better masks or double up on masks. Is that something you think Nova Scotians should be doing as well as a precaution?
So I think, and there's no one thing that it's we call a multi-barrier approach: hand washing, mask wearing, physical distancing. I think right now the recommendation is people wear a 2-ply or possible a 3-ply mask. We need to continue that. I think the most important thing is making sure people are wearing a mask and wearing it properly when they're supposed to. We have mandatory masking in indoor public places. We also advise people whether indoors or outdoors in a different place and they're around other people and they can't be assured of maintaining physical distance, to wear a mask. So rather than worrying about changing the type of mask, making sure you're wearing a 2 or 3 layer mask properly and wherever possible, and certainly where required.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you, Chrissy. We've had a pretty good run this week at containing COVID, and that is exactly what we need to continue to do, is we're waiting for the vaccine supply to be more consistent. I know there have been concerns out there, and Dr. Strang has laid out today ensuring that we will get second dose and use the doses that we have as we wait for new supply. We will continue to use what we have, including the doses reserved for the second shot. The federal government, I know, is working hard to try to guarantee supply, and I'm pleased to see that they have put new restrictions around international travelers, requiring them to get tested upon landing at the airport and isolate at a designated hotel until those tests have returned back. This will help prevent the spread of COVID and the variants. While we wait for more vaccines to arrive, and as we wait, we will continue to follow the protocols. You're doing a great job. I'm really proud of this province. I can't tell you how proud I am to be the Premier of this province and to see the tremendous work that you continue to do to control COVID and support one another. And I want to thank you all for working so hard. This has been a stressful 11 months on all of us. But your effort has been inspiring Dr. Strang and I and others to continue to make sure that we are vigilant as we deal with the issue of COVID. And together, we are working and keeping each other safe. So have a great weekend. And as I said earlier, please pick up the phone and check in with somebody.